Why did you initially seek treatment at our office?
I was having extreme lower back pain, which was radiating down my legs, and a very sharp pain, which actually caused my muscles to contract, which actually caused my torso to lean.
Gotcha. And what other treatments had you tried before coming to Carolina Spine and Disc Center?
Back when I was about in my early 20s, I had actually um, been to the hospital when my back had went out and was actually put in a sort of a traction device for a very short period of time, but it wasn't anything like here. I had tried that. Also, I had been sent to a chiropractor. I had also been told that there just wasn't nothing they could do because it wasn't bad enough for surgery. Um, One thing that did help me is I did do some yoga, which actually did help a little bit. Um, so that actually helped a little bit, but never could actually get completely straight as far as fairly pain or an acceptable level of pain free. Um,
So after treatment here, um, from 0 to 100%, what percentage improvement did you achieve?
I would say actually it's 100% improvement over actually where I started. Um, Still, if I do something without thinking or do something erratic, it can catch a slight little tinge in my back. So, saying that, I'd say at least 99%. I have, on a normal average day, I have no back pain. I
Outstanding.
mean, it doesn't bother me at all. I can actually physically go and do things that used to I knew I was going to pay for the next day. Now it doesn't bother me. So I feel a whole lot better, actually.
Please tell me, why did you initially seek treatment at our office?
Divine intervention. Honestly, divine intervention. I have tried many different things, and my son-in-law laid hands on me and said to heal. The next day, my wife and I saw the advertisement for your office, and both of us said, "This is it." I came here, and pretty much this is it. I am pretty much cured.
Outstanding. Okay. What other treatments have you tried prior to
All of
coming
them.
here?
I have tried all of them. I have tried medicine. I've tried going to bed. The Navy put me in bed for 10 days when I was 18, 19 years old. I have tried acupuncture. I have tried massage, uh, muscle compression, pressure point massage. Uh, if there's anything that I have not tried, I don't know about it.
Gotcha. And I know that people are not going to, they're going to look at you and think you're younger than you are. So do you mind telling people your age?
183, 83.
Okay. Now, today's your last day of treatment. What percent from 0 to 100%? What percent improvement do you feel you've gained?
That's a difficult thing to say. Um, I am almost 100% cured, or back to what I would consider normal. Uh, Somewhere between 75 and 80, 90%. And that makes me very happy. It's much better than being in bed for 3 weeks.
And we're glad we could help too. Um, when we first met, you were a little bit skeptical, and rightly so, as anyone would be. What were your what hesitations or skepticisms did you have about starting here?
Well, because of the divine intervention, I was fairly sure it was going to work. But still, there is some skepticism. And I could not, in my mind, see how the decompression thing would work. But I tried it, and it works.
Gotcha. Good, good. Well, I'm glad you've tried it, and I'm glad you're doing better, and I appreciate your taking a few minutes. Really do. Thank you.
Thank you very much. I'm happy to have been here.
Okay. Miss Jane, can you tell me why did you first come to our office?
Well, I had so much pain, I didn't know where to turn anymore. And I thought, and I saw the ad in the paper, and I thought, I'm going to try this. And am I glad I did?
Oh, good. What kind of symptoms were you having when you first came?
Well, I couldn't walk around, I couldn't stand, I had trouble sitting, and the pain was just terrible.
And where was most of your pain at?
Well, in my lower back. And then, of course, I had trouble with the hip, and that wasn't any help.
Okay. Now, what other treatments have you tried in the past?
Well, I've had all kinds of shots. I have had for sciatica, they've given me everything, and it helped for a while, and that was it.
Gotcha. All right. Have you, if you were to score how much improvement you've gotten here, with 0 is not improved at all,
Yes.
and 100% is, I feel 100% better. What number would you say?
Well, I would have to say I'm at least 98.
Good. Great.
98. I mean, I didn't, like I said, when I came here, I didn't expect 100%, but what I've got is just wonderful.
And are you willing to share how old you are?
Oh, of course. Oh, of course. That's the most important part of it.
And go ahead and tell me how old you are.
I am 90 years old, and I will be 91 on my next birthday.
Outstanding. And just for no reason other than curiosity, how many years you've been married?
67, going on 68.
Outstanding. It's a great example to all of us.
Yeah.
Were you a little skeptical about spinal decompression when you first, came? Most people I would expect would be.
Because my husband, he was the one who was more skeptical, and I says, I'm willing to try anything, because of the pain. And so that's why we ended up here.
Excellent.
And
what things are you able to do now that you weren't able to before?
Well, I can walk around, I can do all these things. What I couldn't do before.
Great.
The thing was, like, when you can't walk around, and then you go someplace, you can't enjoy anything if you have to stand and your back hurts.
Mm-hmm.
Not good.
So, what kinds of things are you doing now that you weren't doing before?
Well, I really haven't done much of anything, but I'm going to start now that I'm done.
Outstanding.
Yeah.
Outstanding.
And I won't be doing that kind of, it's going to be very, I have to watch.
You're probably not going to take up breakdancing.
That's right. That's what I told my husband. I said, I feel good enough. I can go out and do polka.
Well, the polka would be a good test of the back.
Yeah, and we used to dance all the time.
Great. Well, I thank you very much for,
Well, you're
for
welcome.
your information.
And it's been such a pleasure, Doctor, meeting you.
Oh, you as well. You as well.